Welcome to concurrent session 1 of the 2021 Illinois Child Passenger Safety Virtual Conference. You have joined the session titled Special Needs Child Passenger Safety by Kathy Youngman. Our moderator for this session is Shad Edwards, and this session is worth 1 CPS CEU. As a reminder, you may network and collaborate through the chat function located in the bottom right corner of your meeting window. Second, we will have a live Q&A at the end of the session. The Q&A function will become available at about 15 minutes left, at which time you may submit questions using the Q&A function. Click the button with 3 dots in the lower right corner of your meeting window if it doesn't pop up. And a final reminder, this session is being recorded. And I will turn this over to Shad Edwards, and he will introduce our speaker. Thanks, Shad.
Thank you, Megan. So my name's Shad Edwards. I'm a traffic safety liaison here in the state of Illinois. I'm one of 7 in Illinois, and I actually work for the Illinois Association of Chiefs of Police. They loan me to the Illinois Department of Transportation. I've retired after 27 years with the Illinois State Police, 30 years in law enforcement. I'm a CPS instructor and handle being a lead instructor in classes across central Illinois. Our car seats that we normally distribute about 400 a year. And one of the top people that we work with is Kathy Youngman and Ginger Street Matter up at OSF Hospital. So with that, I'd like to let everybody know that I'm going to remind you that there's a chat box that can be used for networking during the session. There'll be a separate question and answer box that will come up 15 minutes before the end of the session itself. That is where you should put any questions directed toward the speaker. I'll try and review those questions and summarize those questions for the speaker. The name of this presentation is the Special Needs Child Passenger Safety, and the speaker today is Kathy Youngman. Kathy is going to be assisted by Ginger Street Matter, who works in the office with her. They're both CPS instructors. They do great jobs teaching classes. Kathy has been a CPS special needs technician and instructor for almost 8 years. During that time, she's worked at OSF Healthcare, Children's Hospital of Illinois in Peoria, coordinating the Special Needs Resource Support Center. They strive to meet the needs of children with special passenger safety circumstances across the entire state of Illinois. She does a great job, and she'll reach out to all of us that are special needs and help train all of us that are special needs technicians so that we can help other folks as well. So with that, I'd like to turn this over to Kathy. Kathy, are you ready?
I am. Hello.
Hello, it's all you, Kathy.
Okay.
Perfect. And we don't see your slides yet, Kathy, just so
okay, we're getting it up, just a sec.
Okay. There we go.
Okay. Okay, I think we got it. Hello, everyone. Thanks for coming and listening to me present today. So we're going to be touching some basic points about special needs child passenger safety. And like Shad said, I work out of the Children's Hospital of Illinois in Peoria. I coordinate along with the help of my people I work with in the office, the Special Needs Child Passenger Safety Resource Center. And we have a satellite site out of Cook County at La Rabida Children's Hospital where Craig Sugarman works, and he covers Cook and the Collier counties. And out of this office, we cover the entire rest of the state. So we're going to briefly go over and talk about some various things related to child passenger safety. And then I'm going to demonstrate some of the seats, just a brief demonstration on a few of the seats that we use in our program here. So welcome. So we'll start off with a definition of what it means to work with children with special health care needs and CPS. So they define children with special health care needs as those who have or are at increased risk for a chronic physical, could be developmental, behavioral, or emotional condition, and who also require healthcare services of a type or amount beyond that required by children generally. So a little bit above and beyond what a child would normally need. So some common medical conditions that we see in our work and that you might come across if you deal with special needs child passenger safety a lot. A lot of our program works with low birth weight and premature infants, meaning less than 37 weeks gestation and less than 2,500 grams. So real little ones might have some work in the NICU with them there in the hospital. So you might see a condition like apnea. Common one is Pierre Robin that we deal with, myelomeningocele, spina bifida, hydrocephalus. Femur breaks are a common one that we come across and deal with. Hip dysplasia, other traumatic injuries such as a car crash or a fall. A child might be in a cast due to those, so we come in if they're not able to fit in, a traditional car seat. Or you might deal kind of on the other end of the preemie babies, a long-term medical condition such as autism, maybe a child who has some sort of neuromuscular disorder such as cerebral palsy, and more recently, we've been getting a lot of calls regarding behavioral problems. So those diagnoses can really, span the spectrum of things, but a lot of those kiddos may have some type of escape artists skills that they have. So their parents need assistance keeping them in their actual seats while they're driving, so it doesn't create some sort of unsafe driving condition. So common medical conditions, why would we need to be aware of that as technicians? And I gathered some things that point to why it is important to have a basic understanding of a lot of medical conditions. So it helps to narrow down appropriate seat choices for the child. So if you get a call from a hospital or a medical doctor or a health department and they mention a child has some type of condition, it's good to have a general or basic understanding or to be able to refer to someone who might have an understanding so that you can narrow down the seat choices for that child. It also helps while educating the parents in regard to use of the seat, tips on how to transport the child or drive safely while your child is riding with them. It also helps to understand the child's medical team when they're relaying needs and concerns. We can't stress enough that as our role as technicians, it's super important to work with the child's medical team when they're relaying needs and concerns and working with them in conjunction with them to have the child travel as safely as possible. Working with families. So these are a couple of really important points that I picked out, and it's just critical to remember these things when we're coming in to work with a family and they may have a newborn baby that has some health concerns they might not even been aware of when they went in to have the child, or it could be stemming from they're in the hospital stemming from some sort of accident, or it could be a child with some type of long-term medical condition that's being hospitalized for some certain reason. So we want to make sure when we're working with these families that we're meeting them where they're at. We're starting where it's helpful for them and making the transition as far as transportation really smooth and a breeze for them, so that it's one of the areas that we want them concerned about it, but when they're dealing with a lot of other medical conditions, it's just easy and a smooth transition for them. So one of the main things is, and I consider this a basic respect for the person that we're working with and the family, is to use person first language. So people first language, it emphasizes the individuality of the person, equality. It's really all about dignity of people with disabilities rather than defining the person or people by their disability. We're placing the person first and then the disability second. And it really helps in eliminating stereotypes. So I can't tell you how much parents and caregivers appreciate when we use person first language. And just an example of that is, so instead of coming into, or when you're talking with someone, oh, instead of saying something like, this is a Downs baby, you want to say, this is a child who has Downs, or this is a child who has Down syndrome. So you put the person first and then the disability second. Secondly, is to know who is important in the care of the patient and try to include them in the education and family meetings. So, try to get, if you're responding to a call to report to a hospital, try to get as much information about the family from the person who called you, the medical team, or maybe even if you get to talk to the family before you respond to the call with a car seat, and know who's important to them and try to include them in the family meetings. If you have any, try to include them in the education for these seats. The seats, special needs seats, a lot of times have little idiosyncrasies, and that's a lot of what differs them from traditional transportation. So we want to make sure that everybody that's important, that will be providing care for the child, that will be traveling with the child, that will be helping in the care of the child, just that they're involved in that process and informed. Okay, so do they rely on Aunt Cindy that's coming in from out of town? Does grandma live with them? Does an aunt live with them, an uncle? So who is important with in that family circle, and how can we include them in that, and to make sure that we're respecting the family in that regard. Use language and words that the family will understand. And I know we talk a lot about this with traditional child passenger safety. It's even more so important when we're working with families regarding special needs child passenger safety. So be careful with acronyms and other words. And I used a pretty common one, just CPS means one thing to us. Child passenger safety could mean something completely different to a family, could mean child protective services. Retractor, well, we know what that means and it has a lot of meaning to us and we know what to do with it, but will a family understand that word? So when you're discussing medical terms and those types of things, just try to keep it at a level that the family will understand, so that they can turn around and use that knowledge you're giving them when they're caring for their child and using the seat that we're providing for them. Make sure to interact with and speak to the person you're helping. Use eye contact, use their name, make them a part of the process. So important, even if you come in under the assumption that they can't hear, maybe not be able to see you, aren't communicating back, it's still important to direct communication to them, to have eye contact with them, use their name. There's other things you can do, but those are just some really good things to do when you're working with them that I put down. Okay, seat selection. So the first thing to do, and that we always do, especially in our program where we get a call, is we try to use a conventional car seat if the child can fit in the seat. So we always want to rule out the fact that a traditional or conventional car seat can be used. So if we get a call and a child's in a hip spica cast, we don't want to automatically bring up a seat used for hip spica casts if we haven't ruled out the conventional seat. So the child very well may be able to fit in their regular car seat. So we always want to make sure that we rule that out first. And as a program, it's a strict rule that we go by here. And there's a couple of reasons for that that I outlined here. They are readily accessible. So if the family's involved in a motor vehicle crash, if the seat isn't working for some sort of reason that they're utilizing, what can they do? They can go right out to the store, whatever store they choose, and pick up the same one. So it's easy for them to get a replacement, and it's easy for them to, it's they might have friends or family or anybody where they can see one being used. Somebody may even have the same kind. So we like that they're readily accessible and easy for the family to get. For whatever reason, they may need their hands on a different one that they're using than what they're using. It's familiar to the parents, so they see it a lot. Um, it's what people use. It's familiar to them. So it's also cost effective. So, when you go into a store, whatever store they're shopping at, you can get a seat for much cheaper than what some of the medical seats cost. So once you get up into some of the large medical seats, they can be upwards of, a couple $1,000s depending on what type of accessories you're using with them. So it's much easier to go out and spend 100 or even a couple hundred on a car seat than it is to try to replace a special needs car seat at a couple $1,000s. So we want to make sure, that we're ruling out those conventional car seats. Also, over the years, improved features in the traditional or conventional car seats help to accommodate children with special healthcare needs. So they have a lot of seats, the rear facing only seats, that have smaller harnesses in them. They have more harness slots to be able to move the seat down. You're able to move the crotch clip closer. There's sometimes multiple settings. They have some head support. Some of these traditional seats have even come with a forward-facing recline feature that you would have in years past have a hard time finding that feature on a traditional seat. So you want to use conventional if at all possible. Okay, seat selection continued. So as we talk about seat selection, these are what you see here are the car beds, and these specialized seats are used for low birth weight or preterm infants. You might see apnea or Pierre-Robin, myomeningocele, like I mentioned earlier. Those are just some things, medical conditions that you may be dealing with when we talk about special needs seats and car beds. So here in the middle is the Dream Ride car bed. It goes from 5 to 20 pounds. And to the right on the screen, the larger one is car bed. It goes from 4.5 to 35 pounds. And then on the left of the screen, we have the Angel Ride car bed, and it goes from 0 to 9 pounds. So currently on the market, these are the 3 car beds that we work with. And I'll briefly, when I'm done going over the PowerPoint, we'll briefly kind of show these seats and go over how to install what we can install inside here with one dial-a-belt. So car seat trials are an important thing to think about when you're dealing with preterm babies, low birth weight babies. And the car seat trials identify infants or babies who could possibly experience some sort of respiratory complication when riding in a semi-reclined position of a rear-facing child seat. So we all know those rear-facing seats have generally from that 30 to 45 degree angle when they're installed correctly. So little ones who are born prematurely may not have mature enough muscles or breathing capabilities to be able to withstand that angle, that semi-reclined angle. So that's where car beds come in handy. So, and we want to make sure that the baby, when you're going through the car seat trial, that they can withstand that angle that the traditional car seat is at when if they're going to be traveling home in it. Individual hospitals for car seat trials set their own policies and protocols for that. So as our program goes into different hospitals, we have to be mindful of the fact we're coming in. We have a loan program with our seats, so we're coming in and we're loaning our seat and we're giving expertise regarding, how to use these seats and such. But the hospitals set their own policies and procedures when it comes to protocols for the car seat trials. So it is a good idea, being that car seats and hospitals set their own policies and procedures, to have a car seat trial procedure. And this is just a sample of what we use here, but it's good to have a car seat trial procedure down. Okay. So car seat trials continued. So each preterm infant born less than 37 weeks gestation and less than 2,500 grams should have this period of observation in a car safety seat before hospital discharge to monitor for possible apnea, bradycardia, or oxygen desaturation. And the suggested period of observation is 90 through 120 minutes, or duration of travel if longer, in a car safety seat before hospital discharge. So if above conditions occur, infants should travel in a supine or prone position in an alternate safety device. So correct restraint or fit of the infant during a car seat trial. So you want to mimic what they're going to be experiencing in the car as closely as possible. So this is where it helps to have, a technician performing these things in the hospital, these trials in the hospital. You want somebody knowledgeable about, how a child's supposed to be harnessed in correctly. So you want the straps buckled, you want the straps snug and unable to pinch webbing at their shoulders. So you do that pinch test. You want the retainer clip at armpit level, if applicable. The infant is not swaddled in a blanket or wearing thick clothing, because that's not how we would transport them normally, and no padding beneath the infant. So we see that a lot of times in hospitals where they're set in the seat swaddled, or they have blankets or something underneath them during the car seat trial. But again, when you do these and when you develop that policy and procedure, you want to mimic as closely as possible how the child will be traveling on their way home. And there is a picture of a little one that's harnessed as perfectly, and that's how we want them to look when we're completing that trial. Okay, car seat trials. So this is a part that gets a little bit interesting, because there's a little bit of a hole here. So in process, I should say. So we want to be sure to talk with caregivers about transitioning to a traditional seat after use of a special needs seat is complete. So if the car seat trial, if the child does not pass the car seat trial and they're going home in some sort of special needs seat, we need to educate and inform the parent on, what do we do after, we're home with this seat, and how do I know when to transition out of that? And it's an issue where we run into, kind of a space there where we don't have some answers sometimes. So one, when they're done with this seat, talk with them about, where do they return the special needs seat? Do they bring it back to where they got it from? Is it theirs to keep? Do they need to mail it or ship it somewhere? So we want to have that conversation with them. How do they know when to transfer the child from a car bed to a traditional seat? So some of the things that we tell them, and that nurses and hospitals tell them, is number one, we want the baby to be term gestation. So if the baby was born prematurely, we know they'll be in that car bed at least until they reach term gestation. We also want the baby to meet those minimum height and weight requirements for the seat. So that goes for traditional child passenger safety as well. We don't want the baby in a seat that they're too small for. So at least those two things need to be met before they can transition over. Additionally, the hospital and that family's care team, that child's care team, you know, they need to know whether they should speak with their doctor as to, you know, when to transition out, and will they need to complete another trial, or do they just transition over on their own once the baby reaches term gestation and once they fit in their traditional seat that they're transferring to. So those are some conversations that we want to have with the family, and it's important to direct them, you know, if they're being discharged from a hospital, it's important to direct them about these things prior to leaving. We get a lot of calls on the line about they're not sure, on our safety line, you know, they're not sure what to do now, and babies get, you know, growing and gaining strength, and parents wanting to transition. And so you want to make sure you're informing your clients, patients that you're working with on where to go once they are going to be done with the special needs seat. So car beds are for babies that need to lay down during travel, and these must be installed lengthwise on a vehicle seat. So instead of your traditional front to back installation of a traditional seat, these are installed, as you can see from the picture there, if you look closely, oh, it's not in a car. Well, it lays lengthwise like that against the vehicle seat. So the head of the baby must always face the center of the vehicle. And depending on which of the three car beds you're looking at using, babies can be supine, prone, or lying on their right side, depending on, again, which car seat you're using. So some of them only go prone or supine. Some of them, you know, don't have the ability to lay on the side. So it's, again, you know, you have to know the little idiosyncrasies of the seat that you're working with, the ins and outs of it. Okay, so orthopedic conditions. Here we have easy on vests. So that is a picture to the left there of an easy on vest. There is a picture of a Wallenberg, and these are both used for again, orthopedic conditions. So is the baby in, is the child in some sort of sling? Do they have a cast on? So those types of things. There is also, which I don't have a picture of up here, the hippo car seat. It was discontinued probably, I guess is 3 to 4 years ago, and you still may see some on the market. There are very few left in stock that at this point have not expired. So you may see a few of those. They are usually kind of a bluish, big puffy cover on them, and they look like a convertible car seat. So these are the two main seats that we use for orthopedic conditions. Again, this list is not all inclusive. These are just two of the ones that we use in our program, but there are more on the market. The Wallenberg, as you saw from the picture, uses a hammock style system. It does have optional additional wedges that come with the seat. It goes rear facing and front facing, and it goes from 5 pounds to 80 pounds. It is a stainless steel frame, and it is very heavy. So it weighs about 45 pounds. So, and then, so you want to think about that a little bit if you're transporting it into a hospital or to a family home or wherever you're working with. You may want to think about the limits of the caregiver. You know, can they lift a seat that's 45 pounds? So it's just something to keep in mind. It can accommodate an individual up to 60 inches tall. It is a really good seat, and it came in after the hippo kind of left the market. So we're fortunate to have a replacement for the hippo. So the Easy On modified vests for conditions where you would use it for casts or some type of sling, it requires the child to lie down in the back on a bench seat. So when utilizing it, it's something that you would want to keep in mind, what type of vehicle does the family have? How many people are, again, it's when you want to think about what that family circle includes. So how many people is the family transporting around? How many people do they have helping with the care of the child? Do they have a third seat? So if they have 3 kiddos and you're going to be, um, their kiddo that's in the hospital needing to use the modified vest, um, do they have the ability to be able to transport that child laying down and taking up a full seat? And if they use the second seat and they don't have a third seat, how are they going to transport the rest of the family? So they'll need to call help, make more than one trip, those types of things. So those are things you want to think through with the family. Of the modified vests, there are 2 sizes. There's a small size, the M203, and a large size, the M101. And sizing is based on fitting the torso as well, the height and weight. So in the footwell of the vehicle, a lot of times people want to fill up the footwell when they have the child on the bench seat with blankets and towels and pillows, and you can do that. It, I guess, would make for, maybe comforting to the child to know that it's filled in there. The child might need a pillow for their head and support for their legs, especially if they have a cast that can be a little bit heavier. There is an extremity belt that should be used, and it gives the guideline there for 30 inches. There are also Easy On upright vests. So some buckle in the front and use lap and shoulder belts. So these are from Easy On, the same company that makes the modified vests, and they can be used for a couple of different reasons outside of, casting or anything. So with these upright vests, the child would be sitting upright, and these might not be able to be used if the child is not able to bend, has no bend in their cast or anything. So that's where some other uses come in, such as escapism features and keeping them in their seat. So some buckle in the front and use lap and shoulder belts. Some zip up in the back, especially those that zip up in the back are especially good for use with escape artists, and special latch connectors are available so children cannot unbuckle seat belts. So when you get up into the upright vests and stuff, you just want to make sure that you're really working with the company on measurements of the child and what you'll need for transport. There's a wide range of sizes, and there are a lot of additional features you can add to just the general vest. And when I go for demonstration, I'll just kind of show you how these look. So you can get a basic understanding. You must use the tether anchor for these, and the tether anchor is rather long. So another thing you have to think about is if the family is traveling in a sedan type vehicle, will they be able to use a tether anchor and get the tether anchor tight enough with a sedan if the back of the seat is really close to where the tether anchor is located. So you may not be able to get that top tether anchor real tight in a sedan type vehicle. Okay, so seat selection continuation. So some long-term medical conditions, so cerebral palsy, autism, behavioral disorders, poor neck and trunk control. So large medical seats are those are conditions you might see and use with large medical seats. So some of the seats, again, not all inclusive lists. There are many, many seats beyond the 3 here. These are just some that we use in our program. So there is the Roosevelt seat, which is located in the middle. There is the Wallaroo seat, which is located to the right, the blue and black one. And then there is the IPS car seat. So those are some that we use in our program, but there again are many more beyond those. So large medical seats are front-facing only. They are generally for patients that are a little larger in size. They have a 5-point harness. They're beneficial in that they go up to higher weight limits. These must be top tethered. They are heavier in nature, bigger. So again, you want to consider um, your caretaker here and the families, just their transportation, what they have going as far as transportation. Are they using more than one vehicle? Because if you think about it, transferring a large medical seat from one vehicle to the next is a little more involved than transferring a a like a very light seat or something much smaller. So we want to think about the family again. These can be very expensive, and there's generally an insurance process involved with this. So you want to make sure you're working with the medical team, the technician, the family, and that you're all working together to complete that insurance process. That's where we're getting into physical therapy, occupational therapy. There's somebody that's knowledgeable about the family, about the patient, and completes a letter of medical necessity. And it's really nice to have an individualized letter of medical necessity that really hits on the points and needs of the patient there. Okay, so some recommendations for clinical staff that might be working or dealing with um, special needs child passenger safety, working in a hospital or in some sort of place where people who could benefit from specialized child passenger safety seats, where they have access to them. So things to think about are assess their transportation needs prior to just discharge. So sometimes the process can be a little long in getting the assessment done, trying to figure out, what seat's appropriate, getting the seat to the hospital or wherever the person is at needing the seat, and then having somebody there that's informed and knowledgeable and has the ability to install that seat. So that all takes time, so we want to make sure that we're doing that prior to discharge. You want to arrange for specialized car seats again prior to discharge, get that set up. So with our program, we have a safety information line. Whomever's working with the family, whether that's a nurse, a occupational therapist, the health department, a doctor, a parent, they call our line. We get the information, we gather what we need to talk to who we need to, and then we pick what seat based on our knowledge as child passenger safety technicians with that special needs training, pick what we think would be best for that child. So it really is an informed decision. Sometimes if we're like, it could be this seat or it could be another seat, we can bring both of them. So it's good to get this all squared away prior to them being ready to go home. So we want to educate parents and infants on infants' needs and their options. We want to have clinical staff work with certified technicians to schedule the fitting and the installation with the family. Excuse me. So generally, when you respond to a hospital per se, the process of just getting in, especially with a pandemic going on, and getting up to the room and then doing the education in the room, excuse me. Sit there, getting into the room and then doing the education with the family, then going back out to the vehicle. It is a process. So we want to make sure that we're scheduling that and we're doing that how we need to with the family. So again, some recommendations for clinical staff are to review or establish your hospital policy on car seat trials for newborns. Collaborate with certified child passenger safety technicians within the hospital, know who they are. It's good to be able to, if you can, call on them and excuse me, their knowledge about um, policies and procedures. We want to designate clinical staff, if possible, trained on assessing child passenger safety needs. So here at the Children's Hospital of Illinois in Peoria, our program is trained, and the nurses can specifically come and speak to us and call on us, and we come with our child passenger safety knowledge and training, and we work with them up on the hospital floor to try to get those needs met. So how does your hospital, um, if you're working in a hospital, you want to look at how does your hospital respond to that, and what processes do you have in place. And ideally, we would love it if somebody could become, if clinical staffs could become a certified child passenger safety technician. It makes our job a lot easier. We are not 24/7, so when we're home and not working, it's helpful to have people on staff that can do those installations. And then car seat testing is a clinical procedure, so it should only be done by medical personnel. And the American Academy of Pediatrics outlines, some of the expectations for that. So it's helpful to have a person that's doing these car seat tests or car bed trials to have child passenger safety knowledge, so that they're being done correctly, and again mimicking how a child should be harnessed and how the seat should be as close to what they're going to experience during transportation. Okay, it is beneficial for hospital, nursing, therapy, medical staff to have certified child passenger safety technicians who are trained and experienced and who can keep up on the technological advances. And of course, that would be ideal. So, if you work in a hospital or a medical facility or health department or whatever it may be. So, what staff do you turn to for that, and what are the processes and procedures in place? Okay, and then additionally, if they have that special needs training on top of that, a lot of times there's mom baby units, postpartum units. So traditional child passenger safety technicians are good on those. But if you have a NICU or a PICU, or you have kiddos come in for orthopedic procedures, it's additionally helpful to have those technicians trained in special needs child passenger safety and who are knowledgeable about those seats that could offer that help in addition to the traditional realm of child passenger safety. If a hospital has trained technicians on staff, our program coordinates with them to ship and deliver a seat, and we ship the paperwork to the staff person who is trained for installation. So it just makes the process quicker and easier. And otherwise, we're responding, or whatever program you're working with is responding. So you want to make sure that process is seamless, and that you have it figured out. So if you call and the person's ready for discharge, what if whatever program you're working with or whoever you rely on for installations and that sort of thing is not available right at the moment, or maybe even that day. So it's good to have these processes down and try to get certified trained staff for child passenger safety. So our program offers, excuse me, I have a tickle in my throat, consultations to families, pediatric specialists, hospital nurseries, daycares, pediatric rehab, and all agencies that transport children. We provide training and in-services to facilities throughout the state of Illinois on issues related to child passenger safety, and especially special needs child passenger safety. We have programs staffed by certified child passenger safety technicians, and we are all here trained in special needs CPS. Myself and Craig Sugarman, who responds to calls for our satellite site, are certified to teach the Safe Travel for All Children, Transporting Children with Special Healthcare Needs curriculum. So it's not an additional certification. It's a enhancement to your child passenger safety technician certification. So, and it is noted on Safe Kids if you take and pass the training. We're hopefully going to have a couple of those this year. Last fiscal year, we were able to fit one in before the pandemic happened. So the other ones we scheduled and rescheduled, and then scheduled and rescheduled again. So we're hoping this year, with things starting to open up in our area, that we will be able to get 2 or 3 of these in. So, and I usually send that out to the list of technicians in the state and the traffic safety liaisons with IDOT to let everybody know that we're going to be doing one of those. So once I start coordinating with the Craig Sugarman at the satellite site at La Rabida, we'll get that word out. So additionally, our program here offers specialized seats if it's appropriate. So we have a 2-month loan program. And what we do is we loan a seat to parents, and it is it could be, you know, one of the car beds for premature babies, or anywhere in between some sort of orthopedic condition, or it could be a large medical seat for escapism, a child who has some escapism features going on, some behaviors that are going on, and we work with the family on proper installation, and we try, especially with the large medical seats, to work with their medical team in place, because it's important to make sure that we're, you know, providing a seat isn't going to solve every problem that the family has regarding transportation. So we want to make sure that the family is connected, and that when we're providing a seat, there's some additional work going on to help address some of those behaviors, and that the seat's going to be used appropriately. And once you get up into, you know, some of those areas where we're looking at escapism behaviors, we just want to make sure that, you know, we need like specific measurements for some of those things, and we want to make sure that we're getting you know, that we're providing the best service to the family, and that they're getting what they need. So it's important to really work with especially once you get up into the large medical seats, that you're really working with the families and their care team that's in place. So seat selection will depend, of course, on medical need. That's where assessment comes in. So, you know, we have the knowledge about the special needs seats. We have the knowledge about seatbelt systems, and we work with the medical team. So regarding medical stuff, we always defer the parent to their medical team. Okay, that's very important. So we have the knowledge about the seat. We have the knowledge about making the child safer during travel. We know how to lock a seatbelt in place and make sure the retractor is appropriate, and we're familiar with these seats, but you really have to work with the medical team and defer to them for medical concerns. Okay. Must be educated by a certified technician. So in our program, when we're working with you, we trust that, you know, if we're sending you a seat, that this seat and this work with this family is being installed, and that the work with the family is being done by a certified technician. And we do have paperwork then that is completed with the family and sent back to us. And that connection is really important, because the whole point of our program is making sure that people are you know, educated, and that they're traveling safely. And we want to make sure all that's happening when we're loaning a seat. So when we loan a seat, it needs to be done by a technician. Okay. Proper selection, installation, and fitting of the special needs restraints for patients. So yes, we work with them when we loan a seat on making sure it's properly installed, that it's the correct seat, and fitting of the special needs restraints for patients are done correctly. You know, we do not have a magic wand, so we do our best, and sometimes, you know, we have to have those good boundaries set up. Sometimes there's just not a seat that we're aware of that can help, and we stick within what we know, and if we're not able to help, you know, we're honest and forthright with that. And sometimes, you know, there are rarely, usually, but sometimes there are situations in which we're not able to help, or there's not a seat that will fit a specific condition or need that's been brought to us. And you know, in that type of circumstance, we may be looking at um, an ambulance transport or something along those lines. We never hope for that, but and we try really hard to find a good fit for the family. But sometimes, you know, it's we work with what we have. So seat replaced and destroyed in case of crash. So we work with the families. A lot of the seats get new harnesses and stuff put in them once they're returned and go through a sanitization process. Seat return to program for inspection and cleaning. So, um, and this is our on here down in the red at the bottom is our Children's Hospital Safety Information Line to our program. Again, we cover the entire state of Illinois. It's myself and Ginger, who's going to be who's helping me here today, and my other coworker Jordan, who work out of Peoria here. So we respond to the whole state, aside from Cook and Collier counties, and Craig Sugarman does that up in Cook County. So, but you can reach the entire program by that safety information line there, and you leave a message, and we check the line regularly throughout the day. We're open except major holidays, Monday through Friday from 8 to 4, and we do you know, we're gone from our desk a lot. So if you call, make sure you call the safety information line, because we never want to be in a position where you know, we're out doing on calls and down, you know, in a different part of the state, and you've left a message on our work voicemail. So make sure you use that safety information line, because we call into that. And if you are needing same day response, we require a minimum of 3 hours notice, and we do that so that you know, we provide good service to the family. So we try to be as helpful as possible, and we really don't want people waiting. So we ask, you know, that you give us plenty of notice, and know if you're um, hours and hours away, that sometimes that is a process to get that seat there and to get the proper people there to help you. And give us, if we're shipping out a seat to you, or like I said, responding far away, give us as many days as possible. So if you know a kiddo is coming in the next week and you're going to need a certain type of seat, and let us know. So, okay, so what happens when we come out? I've kind of covered this a little bit already, but the Special Needs Resource Center is located at OSF St. Francis Hospital in Peoria, and cover all the state except Cook and Collier counties. Craig Sugarman is at La Vida Children's Hospital in Chicago, and he covers Cook and all the Collier counties. So any hospital, clinic, social work agency, or family can contact the Special Needs Resource Center, and the special needs trained CPS technician will consult with the family, contact, you know, whomever is part of the medical team, and bring in or ship those restraints. Okay, so the technician first meets with the staff and or parent. We'll go through positioning of the child in their room, school, home. We'll educate the parents, disseminate the information. We fill out the paperwork, parent and technician install the restraint in the automobile together. Again, this is just the same as traditional child passenger safety. So we want the parents doing the work. But with special needs child passenger safety, it may require a little more assistance from the technician, especially if you're dealing with a heavy seat or a big bulky seat, or, you know, those types of things. Okay, so now we have a demonstration.
Hey, Kathy.
Kathy, I'm willing to break in and let you know that you have about 1 minute left before questions.
Okay. Well, I am ready if you wanted to.
Sure. Well, thanks, Kathy. That was a great presentation. Sorry we didn't get to the demonstration,
Okay.
but we already have a few questions in the Q&A. If you do have questions for Kathy, please go ahead and put them in the Q&A box. I'm going to turn it over to Shad, and he'll go ahead and facilitate the Q&A with you, Kathy.
Awesome. Thanks.
So,
Thank
Kathy,
you.
here's some of the questions, and there were several. Just so you know, with regards to car seat trials, is there any protocol on retesting when transitioning from a car bed to a rear-facing car seat?
You know, that's where that little loop is in there, that hole. So if I understand the question right, the child's in a car bed and they're going to be transitioning out of the car bed into their traditional seat. Is that
Right.
it? So that's where there's a little hole in the process. So that's where it really is helpful if the hospital has their own protocol and follow up with the family. So, do they want the family to, come back in for a retrial? And if so, where's that going to happen and who's equipped to do that? Because some doctors' offices are not equipped to do that. And then if you're going into a hospital, you're looking at bringing quote unquote a dirty baby, so a baby that's been discharged back into the hospital, which is not allowed sometimes. And then that's how does billing work for that? So you have to talk with the family about what that process is going to look like. So, and a lot of times that will fall to, whomever the pediatrician or whomever the family's working with once they're discharged. So there's no good answer to, how to fix that, but there is a little bit of disconnect in that process. So you have to figure out, talk with the family about that. So the two things
Sure.
that we have are for the process, if there's not a lot of extenuating medical conditions, so you want to make sure the baby is term gestation. So if they're born premature and they still have 3 weeks to go before, they reach that term gestation point, the baby will be in their seat for at least 3 weeks. And you want them to meet those minimum height and weight requirements for the seat that they're going to be transferred over to.
All right, perfect. So I've got like 5 more questions, maybe 6. So I'm gonna shoot them at you. Let's. All right, here we go. How do you handle after hours calls?
So that's where that's the reason that Craig and I are certified to teach that additional training to get technicians trained in special needs child passenger safety. So somebody can call our hotline after hours, but again, we're Monday through Friday from 8 to 4. So if somebody is trained in special needs child passenger safety and we work with them, we can ship them a seat and they can utilize that. We develop agreements with hospitals in various places to keep some of our seats on hand so that they have a little stock of them to use after hours, as long as they have somebody on staff that is a certified child passenger safety technician and we feel that they're knowledgeable about the seat and able to install it correctly.
Perfect.
Okay.
With regards to hip spica casts, do you have a conventional seat that you oftentimes try to use?
Not a seat specifically. Nothing I would say that is specific to that. What we do is we see what the family has and we see if they would fit in, if the child fits into it based on how they're casted. So kids are casted, each cast is so different. And then each doctor casts differently. So there's not really a seat that we go to or refer to. We just have to take it on a case by case basis and see if, they will fit in whatever traditional seat the family's using.
Perfect. If a person has, I know the answer, but I'm going to let you answer. A 5-year-old that weighs 80 to 100 pounds, what's your suggestions there?
Well, that's another area that we've been coming up on, whether it's a medical condition that has, that they're a little bit larger or they're obese or whatever, and they're needing a more like forward facing before we would forward facing them, or whatever the circumstances are. You would look at just the most least restrictive, the most you would just look at what seat is going to work. It's really a case by case basis. So, what seat can you find that still has the maximum amount of ability to keep them restrained safely, but advancing as slowly as possible. And sometimes if they just won't fit in a seat, that let's say they still need to be rear facing or something, so if they're too big for any rear facing seat, then we would put them forward facing only because we absolutely have to. So it'd be better to have them in something than in nothing at all, or into something that they've completely maxed out the height and weight on.
So your high weight harness, like your Britax Frontier or something like that, if you had to.
They're like Priya 85, I think, is one. So
Right.
it's kind of doing some digging and researching. So
I'm sorry, but we're
running out of time.
Yeah, we're gonna have to
okay.
end. Kathy, I'm sorry. I hope this is okay, but I put your email address in the chat in case somebody had a question we didn't get
that's
to.
Great.
And then, so thank you, Kathy. That was great. That's the end of our time for this session.
Okay.
Thank you for everyone that joined us, and make sure you look at your participant packet for connection to the next concurrent session. And make sure when you're done, you close out your browser completely before clicking the link to the next session. And if possible, try to join your next session before stepping away to take your break. The next session starts again in 5 minutes, or 4 minutes now, at 11 o'clock. So thank you.
Thank you.
Thanks.